When we began the Affordable Care Act here in Illinois, it was a great man named Paul Simon who had stepped down from the U.S. Senate and through the Illinois School of Public Policy down at SIU, which is called the Paul Simon School of Public Policy now. He summoned two chairmen down to him in about 2001 to start the discussion of universal health care in Illinois. To start the discussion, as we call now, affordable care, but then we were calling it universal health care and health care for all. Paul had a room full of doctors that stretched from here to the back door, and many of them were very undecided as to where this was going. But Paul summoned down this person, as I was the chairman of Human Services in the House of Representatives at the time, and presents me with, of course, my colleague and friend, and now the President of the United States of America, then Senator Barack Obama. And they hand me legislation that says we will start a bill in the House of Representatives, and Willie, we need you to sponsor the bill in the House, and Barack, you're the chairman in the Senate, and you will take it there. That began the long road to where we're at today. That House bill original number was 2268. House Bill 2268 in its original form was for us to have 29 hearings, which we had to water down this legislation a bit, and you wound up having 29 public hearings around the great state of Illinois. I don't do all those hearings. I build castles and move on. Barack wanted to take this where he needed to take it, all the way to the White House. And so what we do is build good public policy. Of course, I ran it and got 118 to 0 votes in the House. And of course, Barack had tremendous challenges in the Senate and did a great job in getting it out. And now they call it Obamacare, which I think is inappropriate. I think it's a sting on him. It's really Affordable Care Act. I think it actually has some racial overtones by calling it Obamacare. I think that's, as a minority male, I think that shouldn't be called. That's my editorial, how I feel. Other than that, we have moved forward with it, and pretty soon you'll be hearing about the Mental Health Parity Act, which I've also authored and has been signed by Governor Quinn. So we're very proud to know that today, Willie Delgado, 15 años ya en la legislatura, 15 years in the General Assembly, for me it is an honor to be here with you, because now I'm the chairman of education, and I'm not doing the education workshop. I'm here with you to put my ribbon around that's of my work here in Illinois, and try to bring this expert panel that we're going to have to help me understand what mess we've got ourselves into, knowing that all of America needs to be covered. So with that said and done, I need to bring up our panelists, and we have Mr. Jose de la Rosa, and I hope I have the current list, as Senior Director of Corporate Strategy, Blue Cross Blue Shield of Illinois, and thank them so very much as they were at that table and at the table on the mental health parity and very instrumental in assisting me. Laura Phelan, Marketplace Policy Director, Get Covered Illinois. Please join us. Mr. Salvador Serna, I get to reunite with Sal, who's done major work around immigration issues and many, many other issues in the 4th Congressional District, and now is the Regional Outreach Coordinator of Get Covered Illinois in the Governor's Office. We also have Mr. Jose Espinoza, who is a state certified navigator. Campaign for Better Health Care, which is the vehicle for all of the work we did, and without them, I would only be a sponsor, and Campaign for Better Health Care, and Jim Duffett as their executive director at the time. Well, welcome to the Campaign for Better Health Care, because everybody needs a movement. No one legislator can get it done. If they tell you that, they're lying to you. You need to work with the people and put them on the stage of government. And then, of course, we have the irrepressible, para mí, one of the reasons why I continue my activism in public health in the state of Illinois, and that is Carmen Velasquez from Alivio Medical Center Universe, that now houses and helps people in Chicago and Cicero, and I'm just so honored to know this family. And thank you, Carmen, for everything you do for the communities of Chicago. So, with that said and done, I get to be the Dick Clark of today and just moderate and enjoy this with you. We're going to start out here, and I want to go, if you guys have an order you like to start in, and if I'd like to have some logic to it, yes. Yeah. So let's do this so that we could have a chronological, and I'm going to follow your lead. So for the record, introduce yourself, say hello, and let's rock and roll, and put a little salsa too. Let's enjoy. Let's have a good morning here. Now, the question is today is the Affordable Care Act and its implication for Latinos, and many of us have known of the gaffes, if you will, in the computer system, although I still strongly believe it's a diabolical plot to make us fail, and we have to continue to fight that. No further, please introduce yourself, and let's move forward.
Hello, everyone. Thank you for joining our breakout session today. I'm very excited to be here. My name's Laura, and I do policy for Get Covered Illinois. And I just wanted to start off with a really broad overview of the Affordable Care Act and the coverage expansion, and then I'll pass it down the line, and they'll get into some more details about what it's like on the ground. So one of the primary goals of the Affordable Care Act was to expand access to quality, affordable health coverage. There were a few ways that this was done. One was through the Medicaid expansion, which Illinois, some states didn't expand, and it created a coverage gap for some low-income consumers. In Illinois, we did expand Medicaid. A lot of people previously, when you talk to people, they would think that if you were poor, you could be on Medicaid, and a lot of people didn't realize you not only had to be low income, but you also had to fit into a category. So you had to be low income plus a kid, low income plus a parent or caretaker relative, or low income and pregnant. And now for the first time, you could just be low income, you could be a childless adult and get access to affordable coverage on Medicaid. They're also, through the Affordable Care Act, they created the health insurance marketplaces. It's private insurance, and the federal government, on a sliding income scale, gives consumers without access to other minimum essential coverage financial help through the form of premium tax credits, and then also cost-sharing reductions to make it more affordable. The other side of the marketplace, there's an individual side, which is what we'll primarily talk about today, but there's also a section for small businesses. So if you have 50 or fewer full-time equivalent employees, you can come on to the shop marketplace, and you can look for coverage for your employees. If you're an even smaller business, you can qualify for some tax credits to help the employers pay the cost of the employees' premiums for their contribution. It makes it even more affordable for them and lets them compare across plans all in one place. So in addition to expanding access to coverage, the Affordable Care Act also added some important consumer protections. So it established 10 essential health benefit categories. And that's really important because previously you may have read or heard stories about people who thought they had insurance, they paid their premiums every month, they thought they were covered, and then they would get cancer, or they'd be hospitalized, and suddenly found out that their plan actually didn't cover that. And even though they had been paying their premiums for a month, were now on the hook for huge medical bills, and had to choose between sometimes whether or not they wanted to take the medicine or try to get better, or potentially looking at financial bankruptcy. It also eliminated annual and lifetime dollar limits. And that's also important because sometimes, again, people paid their premiums every month, they get really sick and suddenly find out that when they really need their insurance, it's not there for them. They'll only cover them to a certain amount, and then it's back to the consumer. It capped out-of-pocket costs for consumers, and again, that's to protect them financially so that it's there if they get sick when they need it most. And then you can no longer deny coverage or charge someone more just because they are sick or because they've had high health care costs in the past. At Get Covered Illinois, we're committed to creating a culture of coverage. And so we don't want people to have to worry about, am I Medicaid eligible? Am I Marketplace eligible? Where should I be? All we want you to do is know that you need health coverage, and to come forward, and we'll help you get to where you need to go. And so we have a paid and earned media campaign. We've been holding it back a little bit, waiting for the website to work a little better so that we don't send people en masse to a website that's not working very well, but we're hoping to really have an uptick in that soon. The website's supposed to be working better in the near future. We also have on-the-ground efforts. So we have navigators across the state that provide free in-person help to consumers. They've gone through a lot of training, background checks, been certified by the Department of Insurance. They're not allowed to take any money from consumers. They're there to provide unbiased help and really listen to their needs and help them navigate through the process of applying and selecting a health plan. And then we also have our Get Covered Illinois website and help desk. And you can go to the website or call our phone number. It's 866-311-1119. And our website is GETCOVEREDILLINOIS.GOV. And you can find Illinois-specific information. You can type in your zip code or address or tell the call center representative your address and find a navigator near you to help you in person. And you can also answer a few simple questions that'll help you get to the right place to apply. And so just based on a few simple questions, we'll recommend for you to start on ABE, which is the state's new Medicaid application. You can also apply for SNAP and cash assistance there, so food stamps and TANF. And then if your income's a little higher, we'll send you to the marketplace to apply.
Laura, can you please give that phone number again, that 866 number?
It's 866-311-1119.
Thank you.
Yes, and if you call the help desk, you'll go through the same set of questions that are on the website, and they'll get you to the right place to apply. The important thing to know about that is if you somehow started in the wrong place, they'll send your application to the right place. So if you start at the federal government on the marketplace, but you should have been in Medicaid, they'll send your application to the state and vice versa. But we're trying to get as many consumers as possible to start in the right place, just because it makes the application process a little faster and will help them get their coverage sooner. And then I also just wanted to talk about a little bit more about the financial help on the marketplace. Generally, it's for consumers with incomes between 100% and 400% of the federal poverty level. 400% is a little over $94,000 for a family of 4, and it's if you don't have access to an alternative form of affordable quality coverage. So you can't choose between Medicaid and the financial help on the marketplace, or Medicare and financial help on the marketplace, or even good affordable employer coverage and help on the marketplace. The financial help on the marketplace is for people that don't have anywhere else to turn. They don't have another option. As long as you're a U.S. citizen or legally present, you can buy coverage on the marketplace, but you would have to pay full price unless you show that you don't have an option somewhere else. Another important thing to add is, I know that I said it was from 100 to 400% of the federal poverty level. There is one exception, and it's that if you're below 100% of the federal poverty level, which is where you would normally be on Medicaid, if you're within your 5-year waiting period, or what they call the 5-year bar, then if you're legally present and you're in that bar, you can get on the marketplace, and they'll basically treat you as if you were at 100% of the federal poverty level, even if your income's lower. Another thing that I wanted to talk about is lawfully present. Sometimes that's confusing to people. It includes qualified non-citizen immigration status, humanitarian statuses, including temporary protected status, special juvenile status, asylum applicants, Convention Against Torture, victims of trafficking, non-immigration visas, and other legal statuses like temporary resident status, and more. And there's a full list on HEALTHCARE.GOV. And then before I turn it over to Sal, the one last thing I wanted to say is many immigrant families have mixed status. And so they have family members with different immigration and citizenship statuses. And also some families have tax-paying members who are undocumented, and that's okay. Those families can all still come to the marketplace, and they can get a tax credit for the family members who are eligible for coverage and are either U.S. citizens or lawfully present. And so if you're a family member, You apply, you have to put everyone in the household on the application. However, they're only going to check the immigration status of the people who are actually applying for coverage. They do ping against a few different federal databases, the Social Security Administration, Department of Homeland Security, but they're not allowed to use any of that information for immigration enforcement or anything like that. It's really just to find out if you can get marketplace coverage. And then if you're undocumented, you can continue to buy coverage outside of the marketplace, and you're not subject to the individual shared responsibility requirements, so you don't have to pay a fee or anything like that. And you can claim it if you file taxes anyway, you can just claim it on there, so it's not an extra step. And so with that, I will turn it over to Sal, and I can take questions after.
And yes, and what we'll do is we'll go to questions after we all wrap up here, if that's okay. And we have a wonderful person here also from Representative Berrios' office. She'll have a microphone who will be able to come around and make sure you're mic'd. Before we go on to Sal, I just want to pay respects. We have a wonderful elected official here, former senator, now Cook County Commissioner, and that is our great friend Jesus Chuy Garcia, who's here in the audience. And very, very important to our process. And also want to acknowledge a dear friend of the community and now an appointee of the governor as the Secretary of the Department of Human Services, and that's Secretary Sattler, and Assistant Secretary Nerida Smyser from Humboldt Park, and always want to welcome them here also. I know many of you are dignitaries in your communities, and if you let me know, I'll be more than happy to acknowledge that also, but I do want to make that wonderful recognition. They do a lot of good work in our districts, and sometimes we have to pull each other's hair a little bit, but at least they're at the table and we're getting off the menu little by little. Let's move on with, and so again, we'll do that, and let's try to keep our as 5 minutes, because I did steal a little bit of time here. Sal?
Thank you, Senator.
Métele mano.
Gracias. My name is Salvador Serna. I'm one of 10 regional outreach coordinators who are responsible for the Get Covered Illinois, working under the governor's office. I'm one of 10 regional outreach coordinators. The state was divided into 10 regions. My region covers the southwest of Chicago, most of the Latino, Little Village, back of the yards, Pilsen, McKinley Park, Brighton Park. Where approximately 95,000 undocumented reside, 95,000 uninsured reside. Recently, in a conversation with Commissioner Garcia, we were speaking about the uninsured and the work that the county, the great work that the county is doing. And, he mentioned that maybe 15,000, between 15 and 25,000 have been covered through county care. 10,000 have been counting through county care. As you know, county care is the rollout of the Affordable Care Act. And so if we're talking about 95,000 in the Southwest, as the commissioner mentioned, we just scratched the surface. There's still a lot of work to be done. And it's by no coincidence, keeping that in mind, that the state was very smart in hiring, partnering with 44 organizations throughout the state of Illinois to carry out the enrollment, the education and enrollment of organizations. Very smart, because who better than organizations that work locally with their constituency, that have the trust and the relationship, and for something that is new as the Affordable Care Act. Right? So very smart. Some of the organizations that I'm very proud to work with, very successfully working with, the large organizations are Alivio Medical Center, for instance, local initiatives, LISC, El Hogar del Niño, Pilsen Wellness, the Puerto Rican Culture Center, the Illinois Coalition for Immigrant and Refugee Rights, and under them, there are numerous organizations that are partnering with them to carry out this work. The work is new. At times, the work has been rocky. At times, we've been confronted with different obstacles, but yet, be assured that each and every of these organizations have the community at heart. They're working hard. They really know what they're doing. As Laura mentioned, not only are these organizations have the commitment to the communities that they work with, but they also have gone through training, severe training from the federal and state government. And I want to make sure that we recognize the work that some of these organizations are, and I know that some of the navigators and organizations are here. So would you please stand up?
Navigators.
Of the navigators.
Okay.
I think that, you know, and I have one next to me too.
Thank you, folks. Thank
Stand
you.
up.
Yes, well,
And I
the
just think
navigators.
they're doing a wonderful job, and you know, it's going to be because of their work that the Affordable Care Act, Get Covered Illinois, is going to get done. And you know, I was joking with the commissioner that I seen him more now than before, because every time we're in an event, we have our navigators, we have this relationship, we have this partnership. The partnership has gone beyond just the community-based organizations. The partnership now has extended to elected officials. The partnership has now extended to the media. The partnership has now extended to many other people who in the past were not related to our community, but they see the importance of being part of our community. One of those, for instance, is Enroll America. Enroll America is very interested in working with us, and we have been developing a strong relationship with Enroll America to go out there and try to identify the uninsured and carry out an efficient and effective outreach program. We understand that the highest number of uninsured in the state of Illinois is the Latino community, right? It is the Latino community. So we need to carry out a strong message and a strong campaign, and we're running the Get Covered Illinois in the Latino community as if it was a campaign. Just want to mention one last thing. I mentioned that we have our partnership, and you know, just as an example of one of the partnerships that we have, we're going to be on the 14th. We have had so far one big event, November 2nd, where we touch over 30,000 people throughout the state of Illinois, and we wouldn't have been able to do that without the partnerships that we have with our media. And very successful. One of the things that we're doing different is we understand that in order to be able to be effective in our community, we need to go and develop events that are culturally and linguistically sensitive. So, for instance, one of the events that we held was El Día de los Muertos Coverage Day in Pilsen. And we're always trying to find out, and it was very successful. We had thousands of people on that event, Senator, and it was very successful. Again, Commissioner Garcia was part of the kickoff with other elected officials, and it was very successful. Now we're coming close to November 15th, another very important date. November 15, if people sign up for by November 15, December 15, by December 15, if they sign up for coverage by December 15th, they will be able to receive their coverage by the 1st of January. And so we're carrying out in the state, through our partnership with the community-based organizations, an aggressive drive between the 7th and the 15th. And we're looking for partnerships with elected officials, with the media, to help us out carry this campaign. One of the events that we're going to be with, and I want to recognize also Giovanni, who is from one of the ROCs, one of the regional outreach coordinators in charge of the Northwest suburbs. We're going to be partnering with, for instance, Telemundo in La Gran Pachanga del Año, where they expect about 6,000 people to be at their event. We're going to be doing the same thing with Univision. We're going to be doing the same thing with Azteca. We're going to be doing the same thing with Hoy. So we continue developing these relationships. We want to develop relationships, further develop our relationships with the elected officials, with other community-based organizations that are not necessarily related to ACA, but have an interest. So I want to open this up to further develop the relationships. If you'd like for us to speak after the presentation, I would welcome. I want to see how we can develop this relationship, how we can get some of our navigators in touch with some of the organizations so that we can continue this work. Thank you.
No, thank you, Sal. Your energy level is excellent. That's what we need to hear. as we see these pieces come together. I do want to acknowledge that Director Julie Hamos from HHF is here. Might have left already. I do see one of the assistants, Selma's here with us, and I know we do a lot of work together downstate, is also present, and I want to acknowledge that. And thank you for being here. Moving right along, let's go right to our next presenter.
Hello, everybody.
Hello.
All right, so I'm going to talk about three main topics, just things that we've been doing on the field, how Medicaid and the marketplace, how those applications have been going for us, and specific methods we've been using to reach out to Latinos. So some of the initiatives we've been doing the beginning in October, we focused a lot on education, so really educating our communities on the website, where they can get help, how they can start that application, and teaching them about all the resources that are available to them, especially locally. As we are progressing into December and as we progress through November, we've shifting our focus into enrollment and doing more enrollment clinics, working with community colleges and public libraries and local schools that have opened their doors to their laboratories, computer labs, where people can come and sit down. We'll be on standby. We'll help those people through that application process, one-on-one or in big groups, depending on sort of the culture of every different group of people. We've been working with elected officials. We've been working with all those local organizations where people are already comfortable, and more specifically offering those resources in a culturally competent manner, so people are comfortable talking to you in their language, feeling comfortable about sharing something that is very culturally sensitive, and focusing a little more on the immigration aspect in Latinos. I know that that's a very confusing topic for people as we cross roads with immigration. People are scared, people are concerned, people want to know how they're going to get their children covered, especially in mixed family situations, mixed immigration statuses. So debunking a lot of myths is also one of the things that, we as navigators are out there teaching people and making sure that we are deciphering fact from fiction. On the side of Medicaid in the marketplace, like I had said, we haven't focused such a huge push on the enrollment yet, because we are having those glitches and we don't want to get too many people's hopes up and unraveling these really huge enrollment clinics. But as we are getting more and more success stories coming our way, we are really pushing that enrollment and really being persistent in identifying those people that are eligible for county care, and getting the people that can already get access to that insurance, to those insurance policies and care and medical treatment right away through county care. So kind of working on all levels, county care, Medicaid, the future adult Medicaid marketplace, and helping people understand how they're going to pay for that, helping them understand the tools that are accessible to us, such as the premium finder on the HEALTHCARE.GOV website, and the Kaiser Foundation gave out a wonderful tool where we can play around with subsidies. So giving people these resources to play with in this time of doubt and concern and fear, it really helps people calm down a little bit, and it helps them feel a little more secure that there are options out there and that they will get coverage in one way or another, and that it's not going to financially be a huge burden on their families. With regards to the different outreaches that we're also doing, one of the things that we are finding incredibly successful is the amazing partnerships that we are developing. Like Salvador has said, working with Telemundo, working with all these great organizations, federally qualified clinics, working with all the other navigators, and more specifically connecting people to their local resources. So the Campaign for Better Healthcare, for example, we're serving everybody outside of Chicago proper. You hear about all these great resources in Chicago, but the suburbs sometimes are something that not a lot of us talk about sometimes. So our organization is covering the downstate area, central Illinois, is covering all the suburbs, the northwest, the west, the southern suburbs. We are there for them. So getting my information out to other navigators and saying, hey, if you have somebody out there, send them to me, and vice versa, I'll send them to you. And really working that network, because we're one big team, and it's becoming a very successful network of people who are communicating and sending those people to those resources. So like Salvador had said, get in contact with us, because we are the people that are going to talk to your communities. We are the people that are going to sit there and have that one-on-one and give that person that answer that they are struggling to find on that website, or calling friend and family member that is also kind of confused about this whole process. So really getting us out there in the field. We really want to be out there. We don't want to spend any time in our offices. We want to spend our time out there with the community members, doing presentations, doing enrollment. So the more you send to us, the more we can give back to you. So it's all about collaborating and getting the right resources where we we need to get them.
Wow, that young energy, I'm glad he's here. And that sounds like the community end of what we're doing here. And I was just reflecting back, we did this work back in 2002. And now, say your name for the record, and who do you work with?
Yeah, so my name's Jose Espinoza. I work with the Campaign for Better Healthcare. They're a non-profit organization based out of Champaign, Illinois, and Chicago. So like I said,
And they deserve a wonderful round of applause because they are the table setter for the Affordable Care Act in Illinois and led. And from that, of course, the hearings creates a man who was executive director named Mr. Kaler, which is now Senator Kaler from Peoria. And that was also created through all of this process, as this young man was also, because he must have been a very young man back then in 2002. I love the energy. Thank you so much for your input and making us feel like we can, in the neighborhoods, as self-esteem, calming down, trying to deal with it, that we have outlets to do that. And we know all of our offices are one of those. Let's go on down the line. I do understand we have also, is this Jose de la Rosa, Senior Strategist? Please introduce yourself and let's move forward.
Thank you, Senator. My name is Jose de la Rosa. I work for Blue Cross Blue Shield of Illinois. Actually, I work for Healthcare Service Corporation, which operates in Illinois, Texas, New Mexico, Oklahoma, and Montana. Can you? Is that better?
There we go. That's better.
Blue Cross is a customer-owned health insurer, and as that, the members are our foundation. We do everything in our power to serve our members. And as we've done for the past 75 years here in Illinois, Blue Cross Blue Shield goal is to expand access to cost-effective health care to as many people as possible in every part of the state, whether it's through employer-sponsored health insurance or their newly formed insurance marketplaces. As I mentioned, I work in the corporate strategy and planning office, and I got to tell you guys that, if you're a planner or a strategist, this is either a planner's dreamer or a planner's nightmare in terms of all of the moving parts, everything that has to come together, at least from our perspective. And the Affordable Care Act is the law of the land, and we do everything in our power to ensure that we comply with it. And I want to talk to you about some of the things that we're doing specifically for the Latino community. As you guys have heard all the stats, the majority of the uninsured are Latino, especially in 3 of our states, Illinois, Texas, and New Mexico. And I'm privileged to be a Latino at Blue Cross Blue Shield, especially in the position that I'm in, because I'm able to help our organization with some of the cultural aspects in terms of reaching out to our communities. It's not what we're used to doing. It's not reaching out to your employers who is a different demographic, who may have a mix of employees. So part of what we're doing is that cultural aspect and reaching out. And what I tell our colleagues back at work is that you can't ignore the demographics. They're going to continue to grow, and it's not just about this open enrollment. This is the beginning of a transformative period in our industry, and it's going to continue. And as such, we have to really understand what we need to do from a culture perspective to reach out to our community for Latinos. And what I tell them is, 1 out of 3 in America will be Latinos by 2050. Mm-hmm. And what I say is, if you're not related to a Latino now, you soon will be.
Very true.
So that, to them, it puts this different perspective.
I like that.
It's not my quote. I borrowed it from somebody, but I use it often because it's going to be very true. And everything we do influences, in terms of our business. And just to share with you some of the things that we're doing is, in April, we launched a Be Covered campaign in all of our 4 states. Montana was just joined the family recently, but in Illinois, Texas, New Mexico, and Oklahoma, we launched a Be Covered campaign. And it was an unbranded campaign. It was really more to create the awareness of what the Affordable Care Act was to bring to our states. What does it mean? And just by a show of hands, do you guys feel pretty comfortable what ACA means, what it's all about? How many of you guys feel like you're pretty knowledgeable about it?
How knowledgeable are we, folks? Show of hands.
there's our challenge right there.
And that's why we're here. We need to learn. Same here. We all do.
I agree, Senator, and you guys are not alone. This plays out at every community, every demographic. It's a new law, and it's going to take a while for everybody to truly understand what it's all about. And I just want to just read off to you the top 10 questions that we get through our customer service lines or our Be Covered fairs or working with our partners in Get Covered, which, by the way, we had a care fair on the North Riverside, and we had about 5,500 people show up, and we had lots of our partners there from the community aspect. We had, I believe Olivia was there as well in terms of, some of the just creating awareness from the medical side. I mean, just in terms of, hey, what kind of basic medical things should I do? So that was a very successful outreach in terms of the Be Covered campaign. But I just want to share with you the top 10 list in terms of questions that we get. So starting at number 10, does ACA apply to me? Number 9, how do I find out what I qualify for and what my options are? Number 8, I'm on Medicare. What does ACA mean to me? What about Medicaid? Number 7, are these new health plans any good? Number 6, why can I get insurance now and I could not get it before? Number 5, how do I select the best plan? Number 4, which doctors and hospitals will I be able to see? Number 3, what if I don't get health insurance in 2014? Number 2, will I be able to afford it? And the most common question that we get is, I've never had health insurance. What should I do next? So you guys can see those are some very, very key questions and some very basic questions that we still need to address. And again, I'm proud to work for Blue Cross Blue Shield of Illinois in terms of the outreach that we're doing, and some of the things that we have ahead of us. And again, it's a long open enrollment period, and it's not the first. So there's a lot of things that we can do now. I think at the end of the day, we need to engage our communities, we need to educate them, and ultimately enroll them. And with that,
And thank you for that, Jose. And I want to also thank Blue Cross Blue Shield. They are at the table on the long term with us, and the work that I'm doing on the Mental Health Parity Act, you were very instrumental on, and that's something we have in employment place. We'll talk about as we go down the road into 2016. We'll stick firm on the ACA. But further ado, because we want to have time for question and answers, we're going straight to Carmen Velasquez. We're wrapping up with Carmen. As soon as we do, we'll have a moderator here with a microphone. Feel free to come to the center. Ask your question. Please keep it in the form of a question quick. We have about 40 minutes, so we do have quality time left. Carmen, if you will, and thank you, Jose.
Thank you. Again, my name is Carmen. I'm the director of Alivio Medical Center. It's a not-for-profit, federally qualified health center. We service 9 communities, including our famous Pilsen Louisville back of the Yards area. We're in Berwyn and are pleased to be a servant of the people. Just so I want to set the tone here, I do support the Affordable Care Act, but I, as a community person, don't call it the Affordable Care Act. I call it the Accountable Care Act. And the reason I do that is because, as a member of this community, I am responsible to see how do we open the door to the undocumented. The federally qualified health centers are a conduit, a medical home to those people who are uninsured, the working poor, and of course the undocumented. Alivio Medical Center services the majority of people who are undocumented. We were all excited to hear about the Affordable Care Act, Accountable Care Act. But you and I know that, and maybe I'm just me and ignorant, if I got hit by a car today, I wouldn't know what the hell my insurance was. Okay? I would have to go to Elizabeth, to HR, and say, "Que me toca? Que me toca?" So imagine our community members, imagine our communities going, do it online, go online. You ever try to call AT&T Did you ever try to call Comcast? It's the same shit. Oh, sorry. I apologize.
Different toilet, I guess.
I'll keep it out.
Now, and if you hear a tension in my voice and an aggressiveness, I think every one of us here in this room has to be aggressive. Aggressive because county care left us out. The Accountable Care Act has left us out. And you know what? There's big buts in what's happening right now. There's incredible change that are challenging all of us in whatever we do, whether you're the social worker, the MD, the person who is doing the Enroll and Educate, and my hat's off to you. But the fact of the matter is there's big buts. And you know what? We're consumers. The undocumented are consumers. So how is it that we learn how to play the game here? How is it that we say to a Blue Cross Blue Shield, you know what? You have a not-for-profit managed care plan, but you also make $50 million on that. So how do you put money back into the community so that the undocumented can buy a managed care plan, and you help with that subsidy that they don't receive? How do we do that? How do we open that door that says we're going to get coverage as the undocumented? Several years ago, and by the way, I am a board member and proud board member of the Campaign for Better Healthcare. Several years ago, in a meeting with Jim Duffett that he organized, a mess of us were in a meeting where you had the presence of the director of insurance for the state. And so I said, I'm going to ask this guy a question. I said, is there any hueco, is there any gap that we, as the undocumented, can be part of the Affordable Care Act? But he thought about it, so I give him credit about it. He thought about it before he answered. And he looks and he says, well, there's this thing called the cooperative. Cooperative. I never heard of the word cooperative. And I said, oh, ¿qué es esto? So I hung on to the word. And as I began to kind of want to dig and do research and say, what is this cooperative thing? What is this, so that if it allows us to get into health coverage? So at that time, the male director resigned, and then another lady took his place, and I don't know her name. I apologize. Then I asked her the same question in another meeting with the Maternal Child Health Care Coalition meeting that I was at. Contestó lo mismo. I asked her the same question. She answered the same thing, the cooperative. So I go, because in the Affordable Care Act, in the Accountable Care Act, there were big bucks for the cooperative. And so I said, and it was a not-for-profit. This was a managed care plan that was a not-for-profit. So there you go, not-for-profit. Maybe there's hope. So I start knocking on doors, and I called Jim Duffett. I call our board member, Esther Corpus, and I say, hey, come on. I found out that I often have to read this because I get it mixed up. The Chicago Metropolitan Health Council submitted a grant to the feds and got money to do a cooperative. I'm onto something. So we have a telephone conference. And so then I say to the director of the cooperative with Jim and Esther on the phone, and no, Esther was with me, Jim was on the phone, and I was there with the director. And he says, well, we believe that, yes, that's a possibility. And so there were only 7 states in the country who got big bucks for the cooperative. So right now, as we speak here, I want you to realize that we are a consumer. And as a consumer, if we can buy a car, why can't we buy a managed care plan? A managed care plan that will make sense for the undocumented. Who tells the undocumented, I will not sell you a car because you have no papers? Huh? Have you ever heard that? I haven't. So I begin to, again, knock on doors and say to the Land of Lincoln people, because they came to us, I Leave You Medical Center, said, we want your help to do blah, blah, blah. Talk to me more. So then they say, and then we begin to talk about the undocumented. And so as we talk about the undocumented, so well, let's explore what might be. And I know the Land of Lincoln are not the only people who are looking and exploring to service the undocumented. I know right now, Illinois, how do you say that? Illini Care.
Illini Care.
Illini Care. Todos quieren nuestro dinero. They want our money. But we want a service that is justo, that covers ourselves and our families. And we have to fight for it because they're not going to give it to us. So everyone sitting here has a role to demand what are we doing about the undocumented. And in addition to that, all of a sudden everybody's getting religion. Okay? we want immigration reform.
Right.
Immigration reform. Oh, okay. Immigration reform. Well, if that happens, all hell is going to break loose, because the million undocumented that are in the state of Illinois are going to say, oh my God, they're going to be able to buy health insurance. You know? This is a customer. What about our small business people on 26th Street, on 22nd Street? Who is talking to our people there? Nope. Not even the owners of the businesses that are tremendous and giving us service don't have health insurance. So let me back up. You know, sometimes I like to read the gringo paper, Crane. And the Crane says, the U.S. Department of Health and Human Services defines high deductible plans as those with annual deductibles of at least $1,250 for individual coverage and $2,500 for family coverage. So this lady was over here saying, I think it's she is paying a $5,000 annual deductible. Who in the heck can have the resources to do that? We can't accept that. We have to challenge the system. My hat off to it for all of you who want to be culturally sensitive. Do me a favor. Get a life. Give us a delivery of service that says you respect us and we're going to be able to cut a deal and give us health insurance.
And as we go down that road, Carmen, whenever you're ready to, because I want to segue into questions, but I'm not going to cut you off.
No, go ahead, cut me off.
No, sum up, please, sum up.
Well, summing up, there's so much to do. And I challenge myself and you to continue.
Yes. And I will just close with saying, and as I was a member of the Medicaid Commission, reluctantly for the state of Illinois, and there's people in this room that I've acknowledged and stated, but when Senator Donnie Trotter from the Black Caucus and myself would have to attend the meetings, I call of the rich legislators who were sitting there to decide Medicaid, and the first attack was to say, we can't afford all this. Even though we were marching towards the Affordable Care Act, the first thing they wanted to do was take away services to undocumented children of the undocumented. Children of the undocumented, children who were born here, those seeking asylum. So the attack on the entire torso even started here with us here in the state of Illinois, and shame on us, and shame on my own party, when we were making such draconian type and dangerous type attacks just so that we can balance a budget rather than reappropriate and reallocate and reprioritize spending, because this population we cannot ignore. And as a former DCFS worker and a parole and probation officer, felony, it's very clear that we cannot ignore what is going on in this. So as someone who we walked out of so many meetings, and we have our own directors submitting these type of concepts instead of solutions, I continue to say the fight has just begun. But we are rejoicing and celebrating the fact that not how far we've got to go, but how far we've come up till today. And many of you are making that possible. But God puts it in perspective. So when we all enjoy this afternoon in our suits and enjoy a nice lunch and keynotes and we go back, I know that the workshops I've always worked with, we don't just have a great professional conversation and everybody go away and come back next year. We have to have actions in our communities through health fairs, through all of the things you're doing, and plug in to make sure that we're all linked together in this effort. Please, if you do that, you have your teams and the Chuy Garcias and the Willie Delgados and the other members that are here to do your battle, to do our battle for our moms and dads, just the same. So we have that equipo. So now we have no excuse. We have to make it happen. So with that said and done, we're going to questions and answers, but let's give this crowd, this panel, a wonderful hand. Gente que tienen preguntas, please step up into the center aisle right here if you have a question of any of the panelists, and we have a microphone right here. And I think I've acknowledged quite a few good folks here, but please go ahead with any questions and direct it to anyone you like.
Thank you so much. First of all, Senator Delgado, I appreciate it because I'm a Northsider from Logan Square, and I remember meeting you 15 years ago. So
thank you.
My dad worked for CTA. So my question is this: I'm a Master's of Public Health student at Chicago State University. I'm also the student trustee representative, and it is an honor and a privilege to be here and hear what you have to say. My question is, studying the Patient Protection, Affordability, and Care Act, how much money is being put aside for prevention and screening programs aimed towards the Latino population, considering that we're going to be holding a whole lot of the disease burden in the upcoming years in 2050, being the majority minority population. Can anybody answer that question on the panel? I'm very interested in Illinois. How much access and money is being put aside for preventative and screening programs for Latinos through your efforts? Thank you.
You know, when the Affordable Care Act was in its draft form, I did see some dollars there, especially in relationship to community health workers. But I'm going to tell you, I sure as heck cannot find it right now. Because the voice of the community, whether you call them peer counselors, navigators, we need to have the resources to get them on the ground. So I don't have an answer. If anybody else does, I'd love to hear it.
Right, on the state side,
sure.
from Marketplace.
So I don't know the exact number off the top of my head, especially dollars allocated to Latinos. I do know that there is the Public Health and Prevention Fund in the Affordable Care Act. I know it is a lot of money, and I cannot remember how much it is. But Senator,
let me interject and point out, and excuse me?
16 billion over 10 years.
And that will be over 10 years. However, I need to, please.
Oh, there you go.
Please come up forward, please. Can we get a microphone to this young lady? And in addition, keeping in mind that 17% of the state, according to Illinois Latino Policy Forum, is of Latino Spanish descent. About 6% of the actual dollars in the state budget goes to that population, and that is the battle we have. And thank you for the Illinois Latino Policy Forum, and the Latino Family Commission is addressing some of that too.
Hi, my name is Letitia Reyes-Nash, and I work for the Illinois Department of Public Health. And
Welcome.
I just wanted, thank you, and I just wanted to mention, I manage the Community Transformation Grant for the state, but it focuses on communities outside of the big 5 counties, and it works, and it's from the Public Health and Prevention Fund. Our state was awarded $25 million. There's also funds in Chicago public schools that are doing work. But I just want to mention the Public Health and Prevention Fund. Don't be fooled. That fund was raided through sequestration. The Community Transformation Grant funds were sustained, although we have an immense amount of federal scrutiny. basically spend about 20% of our time just reporting on those funds. And the other part of it is that the funds were siphoned off to pay for the marketplace outreach. So the funds that would have gone to a lot of the prevention efforts and a lot of the things that we would have liked to have done were siphoned off and moved to get people enrolled. And so this...
So it was used administratively then?
Yes, and it was also, the other
Once
part of it
again.
is that that funding pot is constantly under scrutiny. It's on the chopping block every year. We live like we're going to lose it every single time. So I would implore you to look at that Public Health and Prevention Fund and see how you might be able to advocate about that. But the other part is, I wanted to mention on community health workers, our director just presented at the Healthcare Implementation Task Force meeting and talking about how we're going to, as a state, start to look at that component and to educate ourselves on what's already happening in the community and to really think about that and how we want to implement it. The other part is to also know that the 1115 waiver, which is...
It's a federal waiver of 1115, I believe. Chuy Garcia was just here, but for the Cook County Hospital also, and if you elaborate shortly on that part.
Sure. So the 1115 waiver is essentially an opportunity for us to submit to the feds that how we want to expend funds in a different way. And so the argument is you expend the funds in this different way, and then you can save money on the long run. And so right now there are hearings to comment on a draft outline of the current proposal for the 1115 waiver. Health and Medicine Policy Research Group is kind of facilitating the waiver work. And in the waiver work, we have added a public health component that's very vague. And so we're working to develop that out, but that's an opportunity for you to comment on how you would want to have those funds work. And an example of like an 1115 waiver in Texas, they're working to fund community health workers as a component within Medicaid. So we'd have a billing code for community health workers to be able to fund that kind of work happening in communities. So that's an opportunity right now that if you're part of an organization, you can comment. I believe it's the 25th, but you can continue to submit comments for the waiver, because then there'll be another draft that will go back out for public review. So that's another opportunity for you to engage in the policy processes right now that are happening that will kind of set the stage. And remember, Medicaid serves as like a, we want to do things and test things in Medicaid so that then the private sector can look at how they can adapt those things. So it's important for us to really, I think, community health workers is a huge component to think about from a billing code perspective.
And Letitia, the part that was siphoned out for the marketplace, was that the HRSA grants to the federally qualified health centers? Is that what
No, I believe
okay.
that was in the bill. I believe the money that was siphoned off was for the marketplace enrollment. But I'm
Right,
not
for
100
startup, basically,
yeah,
for startup.
right.
That's what it sounds like, which is very unfortunately
Okay.
normal.
Yeah,
There were also grants from HRSA, the Health Resources and Services Administration under HHS, that went to federally qualified health centers, and those FQHCs are now certified application counselors and help people enroll in both Medicaid and the marketplace.
Right, and I guess it's less of a criticism on needing to move the money, but more of a fact that you should know that the public health and prevention intention of implementing true prevention efforts we lost that opportunity, because community health workers is in the Affordable Care Act as a component, and there was a whole kind of primary care component that was in there. So I think primary care extension projects that were going to be funded, all these other things that were in process that did not get funded.
Excellent. And now sort of like Bill Maher would say, okay, now we got to move on to special rules. And we want to continue the questions. And by the way, thank you. And she represents Dr. Hasbro in the Department of Public Health. He was here this morning also. I want to really thank all of our leaders who were here. Please stand for your questions. I'm just still doing housekeeping. Move to the front. We got a microphone right here. We'll have this young lady, and let's start in the back. And yeah, there you go. Fine. Whatever works for you. Come on up. Don't be shy. And we want to thank all of our directors who acknowledged us. And as we're getting ready here, I also want to acknowledge a friend who's come to town and is running now Univision, and that's Mr. Larry Sands, our general manager, and a friend of mine from Puerto Rico. Welcome to Illinois. Ahora, vamos para adelante. Ask you a question.
Hello, my name's Alita, and I actually work for H&R Block, so I actually was hoping that we would have had the tax side of things from somebody to inform, because that's been something we've been dealing with in our communities. We've been partnering with Hispanic Access Foundation, which is a really good non-for-profit organization based off of Washington, D.C. So something that they tried doing this year when we would go into the churches is they've tried to get someone from the state to start talking about the health care coverage, and each time we haven't had them. So we recently did a radio interview, and the biggest question they asked me was, if I'm undocumented, how does that work? Or, how do we get the word out? So I know our company decided we're going to still keep doing the reviews and assessments, let them know how it's going to impact tax time. But then again, nobody realizes that it's mandatory. It will hit in the 2015 tax year, for this year, if they're not covered between now and April, and then how much that costs per person on the return. So something that we wanted to clarify, is that regardless whether you're documented or undocumented, you're working with a social, therefore you're required to file a tax return, therefore a penalty will hit.
If you're not documented, even if you file taxes, you're exempt from the penalty.
Okay, because as far as we know, it's kind of still in the forms, so we don't know how it's gonna come off on the 1040 line.
Right.
So,
and the IRS has, we don't know either. The only thing that they've released is saying that they will modify the tax forms to allow people to claim an exemption, so that they don't have to pay it, but they haven't said more than that.
You guys could add that to you guys, or if we can partner.
From a community perspective, I see your point on North Avenue and Pulaski, where you're located also. Just the fact that also H&R have to, you give me because you also spent quite a bit of money on advertising when as soon as this was being rolled out, when it was in the Supreme Court. I saw your commercials saying, we've just read the entire bill, and they were trying to appeal to that population of people. We should always say hello to any partner that wants to assist our communities. Más preguntas, please. Another question?
Good morning. I'm Diane Doherty with the Illinois Hunger Coalition, and we're a statewide anti-hunger organization, the oldest in the state. And I have a couple questions. My first question is, what are you telling folks who are applying for Medicaid about an appeal process? One of the things that has been a great concern for us, especially for Latinos, Spanish speakers, is not having judges who appeal hearings that are presided over by a Spanish speaker. So with the expansion of Medicaid, which we're thrilled about, and I totally agree with Carmen, too many of our folks are left out, by the Medicaid expansion. But for those who are eligible, what are you telling them about an appeal process if they are denied? And will there be additional Latino Spanish-speaking staff who will be working on the appeals?
Sure, I can start. I'll answer the first part of the question. Regarding appeals, we go through a very specific process. There's paperwork that we have to fill out and send that to Medicaid, requesting that appeal. I have personally not done that yet. I have not had anyone get denied from Medicaid yet for me to go through that process. But there is paperwork that we fill out that has been standardized by the marketplace people, and it's in our training, it's in our booklets, all that information is laid out for us, so we go through that venue to submit that application.
And it's on the Medicaid side, it's the exact same appeals process as in the past. And so they didn't change it. The one difference is that they will have to coordinate a little bit with the marketplace. If the marketplace if the marketplace says you're not eligible because they think you're eligible for Medicaid, and you say, no, I'm not eligible for Medicaid, I'm eligible for the marketplace, then there's some coordination between the state and the federal government on the back end. But if you apply to Medicaid and you're denied, but you think you're eligible, it's the normal Medicaid appeals process. And I don't know I can't speak to the staff, but I don't know if there's anyone from, there we go. Yeah.
Step up. You're on deck.
Hi, my name is Isela Arellano. I'm a hearing officer with the Department of Healthcare and Family Services General Counsel's Office. So when someone gets denied a Medicaid benefit or gets a benefit cut, the hearings go to whatever agency denied it or whatever department denied it. And then lots of them, the Medicaid ones specifically, come to the Department of Healthcare and Family Services. the department is required to provide
A
service.
little
in-
louder, please.
Sure, the department is
there
required
you
to
go.
provide service in Spanish. I myself am Spanish speaking. We have interpreter lines available for people who need Spanish interpretation or any other language, so we are providing that service. As far as I know, as of today's date, I have not received or have not seen an appeal come across regarding Medicaid coverage under the Affordable Care Act, and I would have the same question, who's getting that? I haven't seen a form
neither
saying,
have I.
okay, and I'm sure plenty of people have been denied already.
Well, then we do need to get to the bottom of that, Counselor, and I'd like to work with you, with your department, and making sure that we have a conduit, and maybe that conduit needs to be me, so we can find out. And I'll ask cooperation from the governor's office and from all my other agents to maybe we can find out secretaries back there, and I'll do anything I can to help facilitate you with the President of the Senate, because I think that's very viable and what we need to do there. We also, I'm sorry, please follow up.
I just wanted to make one comment. So I'm the only Spanish-speaking hearing officer or administrative law judge with the Department of Healthcare and Family Services.
Is that all we have is one?
Just one for the whole state. And that's why it's very
All right,
important.
people, you see my challenge all the time? Okay, they love taking pictures with us.
I
But
have not had a-
17% of the state is Latino. We get 8% is in the budget. Now, I was born in Newark, New Jersey. My parents are from Yabucoa, Puerto Rico, La Bellas Lomas. Help me understand.
I wish I could answer that same question. It's a question that I myself pose all the time. There's a big need. I'm really frustrated because I know that the services that we are providing are deficient. And, shame on me for maybe biting the hand that feeds me, but, it's a big problem being.
And I got as the vice chairman of executive appointments for the Senate, I keep asking the governor to send us people that can speak all of our languages. Illinois has 102 counties. And it looks like this room.
Follow up with you.
But if we don't have the infrastructure within the governor's coded agencies of mental health, public health, et cetera,
Right.
then we cannot implement these items, and you will hear the wrath of our community. The hospitals will be, we continue to shoot ourselves in the foot. So again, we've come so far, and yet we're right back to where we start when we look at what's really going on, people.
And that's why I invite everyone to strongly advocate any public interest organizations to
I hear you.
advocate for more representative employees.
No, God bless you. No, I'm going to have to interject a little bit because we have about 10 minutes left, and things like this is why I represent us in Humboldt Park and continue to go down to Springfield, because la lucha apenas está empezando. Let's sum up here, and then we also have our director of the chairman of the Latino Family Commission, Mr. Henry Martinez. Please follow up, and we can move on.
So I had never met her before, I swear to God. That was my question. I'm glad she
Fantastic
was
work.
here. And just one other question, and actually a comment, is that, we need to have more Latino staff in DHS offices, because when push comes to shove, that's the infrastructure that we have to support. And
That's right. And I continue to try to send good resumes that way, but we need to be heard.
And overall, DHS local offices, that's where the rubber meets the road for all of it, because we can go out and get 8 million people to sign up, but if there's not adequate staff and infrastructure within the DHS offices, then this isn't going to work. So again, anything that we can do as advocates, as providers, to talk about the need for adequate funding for DHS.
And how about
I
our
think it's
child
critical.
welfare specialists too at DCFS? I'm a former child welfare specialist. We know what's going on in these families. We live in those homes. Oh goodness, you're getting me all pumped up here. The next questions to any of our panel, and then we want to acknowledge our panel. You have a wonderful lunch waiting for you, and 11 we have about 10 more minutes to wrap up. And I have a nice gift for our panel.
Hi, my name's Allison Martinez. I have a question. I'm an in-person counselor, and I wanted to know if there's any efforts being made to shorten the application process, because what we're finding a lot of times is it's really difficult, especially to get to Latino population in our office, let alone to get them to stand still for an hour or 2 hours to fill out the application. So, is there anything being made way? Because I know that and I'm talking about the state,
Yeah.
so not the federal. So like with the state site, it is moving really slow.
Oh, the ABE site?
Yeah.
So they are taking feedback on the ABE application. So if you have feedback on it, you should certainly send it in. They are currently looking to make it clearer, as well as to, they're conducting an analysis to find out what questions are not mandatory to make the application more dynamic, smarter, so that you're only asked the question if you absolutely need to be asked the question. It's something that they're working on. It won't happen right away, but it is a goal.
Yeah, because what we're finding too is that we are able to get them in, and then something happens with the site, and we lost them. And it's very difficult to get, once they leave that door, it's very difficult to encourage them to come in. And I mean, you can explain why you should get healthcare benefits over and over, but I mean, to really get through them.
And that's why I want to continue to encourage people to have orientations in through their churches, their schools, through their family focus agencies, through whatever outlet you have in your community. Create an action. I've just finished 20 years of a health fair in Humboldt Park. So there's over 3,000 people in one day. Many of you know about it. And this year we completed 20, and that's 3,000 people in one day. Mostly undocumented. So behind every action, we have a diabetic, a diabetic attack in our community in Humboldt Park. We created a center with Mount Sinai Hospital, and you have a diabetes prevention center in Humboldt Park. What we must learn, as the struggles from the past, everything we do must come with legislation or an action and funding. So there's many outlets to get them to sit still and to do all that, because we've had our self-esteems and the anxieties that exist and the strains that exist in the young families that is very difficult to have them sit. In my office, they will sit for one item, and usually it's to help me get their son transferred from a downstate prison closer to home. As I do 37, we haven't even begun to talk about prison populations and the transient reaction and ramification it has when it comes back into the community, between my buddy Tommy Dart at Cook County, which feels he's running the highest mental health facility called a jail, and then the state of Illinois. And you know me, I'm backgrounds in criminal justice. I'm also a former felony parole and probation officer, and I'm very proud of my work, but I've always been on the side of the familias, and that's why I push myself to the front of the class, and with your love, you put some of us in the General Assembly. But I'm finding that I'm dealing with the same kind of criminals that I had to fight with in the street, but these are called politicians. They're more concerned about their next campaign when we're more concerned about the next generation. So it becomes difficult when we work with great lobby that's in this room that fight for the safety net hospitals. Why do we have to call them safety nets? Because 85% of the people aren't paying to go in. They're Medicaid recipient, they're undocumented. There are ERs. We got people like Bruce Simon and Zach Stamps of the world and others that they walk around in suits and ties, but they're fighting for the nitty-gritty just to keep us afloat in many of these communities that we call Chicago and downstate. My friends downstate who are impacted all the time because of lack of transportation. It's not about the color of their skin. It's about our health care. It's about people. And the Latino population has a wonderful opportunity to implement a new style. A style that really isn't new. That is, it's family dynamics and respect and dignity to have access to Affordable Care Act, because no one is born poor. You're just born. And what happens to you is created by governments that we've elected and continue to do the same things to us by creating these issues around us. But now we are rejoicing because we have turned this tide, and now it's called the Affordable Care Act, where all people have access, and of course anything difficult is worth doing. This will take a lot of time, energy, gumption, audacity, and you must be willing to fail in order to succeed. But clearly, at the end of the day, every time I dealt with a child welfare case, what was my goal? The beneficiary of the child, the best interests of your child. So if we can do that, government, and with this star panel we have, from the womb to the tomb, from the youth to the senior, from the brother down in Saline County and Gallatin County, where my good friend Senator Gary Forby's way down there with folks walking between, dirt roads and trying to get a job, let alone clinics that don't have doctors and only have, it's called Egyptian Clinic in Saline County. And all they got is hydrocodone ODs and methamphetamines and a head nurse. They don't even have anything to treat methadone, let alone health care. So when we talk about that and we talk about Cook County, we're talking about the state of Illinois, people. And when I vote for all of you. But at the end of the day, they look at me and they say those Latino legislators are pretty hard-headed. Well, guess what? I'm a legislator. I'm proud to be Latino. But I'm a legislator. My name is William Delgado. I'm your state senator, former chair of public health, the chair of education. Let's give this panel, unless we have one more question, Henry. We have 2 more questions. I'm wrapping this up if you couldn't tell. And then we're going to go to a great lunch, and we want to acknowledge our panelists. Henry, please.
I love you, Willie.
Thank you. Mr. Henry Martinez, and he is the product of my legislation, creating the Latino Family Commission, thanks to Laila Suleiman, the great doctor, and now he is, I believe, the executive director.
Just my question on marketing. The young ladies, my daughter just spoke. And the thing is, I'm very happy when I hear Sal and Carmen and a few others talk about the efforts they're bringing on the Latino family for the Affordable Care Act. But in some areas, you know, we don't have that marketing tool. In the southeast, south suburban area, when we go out, sometimes we go to the schools and other entities. I'm surprised at the attitude that they have, that they heard about it, they want to work, but it seems like they're not joining the chorus that families need help. You know, I'm a proud person that's worked for government for a long time. And one of the issues that is facing us today, more than ever today, is a healthy family. If we don't get behind this Affordable Care Act, you know, in trying to do as much as possible to ring in the young ones and provide for the immigrant, we're lost. We're going to grow up another healthy. But my thing, Sal, since you're out there in maybe the campaign, why is not the board of education or the churches beating the drum about get involved, find out where the senators are that are working to bring in the Affordable Care Act information and a sign up? I don't hear it. It's like when we go to principals, they're willing to cooperate, but it just seems like we'll think about it. Me, I don't think about it. I have to make the issue right now.
I totally
so
agree.
maybe there's some question that more of an effort could be put upon the churches and the institutions, the public, to get involved and support us. That's my question.
Yeah, they were pretty good on robocalls. They can do robocalls on this one. Please, take a shot at this. We do have to start wrapping up. I believe you have one more question.
Well, when you're thinking that it's just in the Southwest, there's 95,000 uninsured, Latinos uninsured, and as Commissioner Garcia has said that, you know, only 10,000 have been reached through county care, you know, it's clearly that it's personal for us as Latinos, because we know, at least we know someone who is uninsured in our community, in our own family. So, and I just want to share something very, very, very brief. And you don't really realize it until it becomes personal, you know, and then you really start taking action. So just want to share this. You know, I was, like many of you at one point in my life, have been unemployed. And when you're unemployed after being employed and having insurance, right, you don't realize it until you have little kids. How many here have had 2-year-old kids in their life, right? Most of us, right? So you have 2-year-old kids in the middle of the night. How many of you have experienced this? They're crying. Right. Can't figure out what's wrong with them. Their little stomach aches maybe, or is their head. They can't convey what it is, right? So you start thinking, well, what do I do? Should I, you know, do I go take them to the doctor? Should I call mom? You know, my first doctor has always been my mom. She gives me the tecito, right? But you start thinking, you know, who do you call? What do? You don't have insurance, right? Wife starts crying, baby's crying. You're about to lose your mind. So then you start thinking, wait a minute. I need to take this child to the hospital. But if I take the child to the hospital, how am I going to pay for groceries tomorrow?
Yep.
Because a hospital visit can clearly start at $3,000, can go up to $50,000 depending, right? So you have to think about this, and you got to say, I need to take a stand, Because there shouldn't be a father who has to worry at night. A mother shouldn't worry about what's wrong with the child. A child shouldn't be in that situation, and a father shouldn't be in a position to decide whether I pay for groceries or I take my little child to the hospital.
You know, I totally agree. And knowing
about
Sal
social
like I
justice.
knows, that's right, Sal. His work is his life is his work, El de Barrio, and I totally can relate to Sal Serna when in terms of his message. I think what organizationally for an important, sophisticated implementation, and one that I always say, you know, I love watching the Flintstones, but we're Jetsons, and we got to do this correctly. And that is that in South Chicago, if you go to Rainbow Beach, if you go by Commercial High, all of our old places we used to hang out when we were young teenagers, and go by Bowen High, and come out of Tilden Tech on the south side. And now making sure that our friends in the steel mills, and I call some of my old days of my Chicano brothers, really, you know, who were guys named my old friends, and they were born in Chicago and from San Antonio, etc., back in the 70s. And so understanding in that Southwest, that little village represents what it is if you're standing in LA or New York or Miami, just like any community. When we talk about Humboldt Park, or we talk about Ukrainian Village or Bronzeville, everyone has an identity, a Greek, I don't care where I'm sitting, I get to represent us anywhere I'm at in the nation. And so we're able to see these things and know what our goals are, and hearing what Sal's talking about is what I believe you all are thinking. And I also want to, so let's get that last question in, because, and then the partnering is also what I want to also leave you with, and that is thank you to all of our partners, including the African American Family Commission, the African American Caucus, that I work very, very close with in the terms of my public health work in our communities, because it touches all of our families. And so therefore, it's about the haves and have-nots. So we cannot break it down on the barrier of skin color. It must be dealt with from Appalachia to the socioeconomics of families, and that's what this is about. Your Honor, and let's wrap up with you.
Buenos días.
Buenos días y bienvenido.
Gracias, igualmente. My name is Carlos Mauricio Lea. I'm the publisher of Un Buen Doctor Health Magazine, the only publication in the marketplace directed to the Hispanic community for health and well-being. Now, I can appreciate a lot of the comments and a lot of the intention, but let's be honest here. Our community, and I feel very strongly about this, and I might be kind of blunt here, I feel like we get lip service over lip service over lip service. I'm really, really, really upset at that, and I feel bad with myself and when some of the other professionals who are not able to handle this properly and manage this situation and put it back in place as it should be. The main question is not a question, it's a comment. We have over 2 million Latinos in this area, right here in northern Illinois, and a lot of them are language dependent. God knows that this new law is very complicated. I'm in the healthcare, I'm in the communications, I don't even understand it. If I don't understand it, can you imagine everybody else? Okay? Now, I gotta tell you, I feel very disappointed as the only publication in the marketplace dealing with healthcare. I don't have a lot of approach from the government, from the agencies, from anybody.
And you've been here at every conference too, by the way. We spoke last year,
yes.
And I appreciate your comments,
Yeah.
but I also want to know, what is the public relations, what is the campaign strategy for public information out there for all the entities to get the word out?
And how do we get to the grassroots? You know, because it's very simple to go and
That's
say,
what
okay,
we've been talking about,
here
though.
from the upper, and there's, and I can appreciate electronic, but you can't say much in 30 seconds. You can't teach our community with a 30 seconds commercial. Let's be honest. We have to go much deeper. We have to go into what is really needed and create a campaign that really emphasizes all these points and teach our people. Our people are lost. So what is it that you guys can do to really embrace this and start teaching our community and start guiding them properly? Because I haven't seen that.
Right, and I'm just going to interject and answer that in terms of what the governor's office needs to do, and I think everyone has articulated what has to be done, and I'm very comfortable and confident with the panel we have here. That type of activism coming from a Latino media side of us, I've always been critical. That's why I actually introduced Mr. Larry Sands, who came here new from Puerto Rico to run Univision, because with all due respect to much of the media, and thank you, CAN TV, for always being here for us, but at the end of the day, I get to call WGN a little bit more and get some coverage than I can get. I'm 5'5", and if I have more film study on me from the other stations, we never see it. They say, well, we don't know about Willie's thinking. Well, heck, if they don't put it on the television, you'll never know. But just come over to 4150 West Armitage in the 2nd District, and you'll know a whole lot. Or go to our websites, and when you go to those websites, look at the actions. Look at look at these health fairs. But anyway, with that said and done, let's give this panel a great hand. We have Jose de la Rosa, Senior Director, Corporate Strategy, Blue Cross Blue Shield. Laura Phelan, Marketplace Policy Director, Get Covered Illinois. Salvador Sedna, Regional Outreach Coordinator, Get Covered Illinois. Jose Espinoza, State Certified Navigator, Campaign for Better Health Care. And Carmen Velasquez, Title Executive Director, Alivio Medical Center. And I still may have a career in radio.